Introduction to emergency response. Emergency response involves immediate actions taken to mitigate the impact of an incident, protect lives, and preserve property. It encompasses a wide range of activities, from initial assessment and first aid to coordinating with professional responders. Understanding the fundamentals of emergency response is crucial for individuals in various roles, including community members, workplace safety officers, and volunteers. Effective response can significantly reduce harm and improve outcomes during critical events. This course lays the groundwork for developing these vital skills and fostering a proactive mindset towards safety and preparedness. It emphasizes the importance of quick thinking and decisive action in high-pressure situations. The primary goals of emergency response are to save lives, prevent further injury, and provide comfort to those affected. This involves a systematic approach to incident management, ensuring that actions are organized and efficient. Responders must prioritize safety, assess the situation accurately, and apply appropriate interventions based on the specific emergency. Training and practice are fundamental to building the competence and confidence required to perform effectively under stress. By mastering these principles, individuals can become invaluable assets in their communities and workplaces, contributing to a safer environment for everyone. Defining emergencies, types and characteristics. Emergencies are sudden, unexpected events that require immediate action to prevent or minimize harm. They can be broadly categorized into several types, each with distinct characteristics and response requirements. Understanding these classifications helps in anticipating potential risks and developing targeted preparedness strategies. Common categories include medical emergencies, natural disasters, technological failures, and human-caused incidents. Recognizing the specific nature of an emergency is the first step towards an effective and appropriate response. This foundational knowledge is critical for all individuals involved in emergency preparedness and response efforts. Medical emergencies involve sudden illness or injury, such as heart attacks, strokes, severe bleeding, or allergic reactions. Natural disasters encompass events like earthquakes, floods, hurricanes, and wildfires, which are often unpredictable and widespread. Technological failures can include power outages, infrastructure collapses, or hazardous material spills. Human-caused incidents range from accidents and fires to acts of violence or terrorism. Each type demands a unique set of skills and resources for effective management. Proper identification allows responders to quickly implement the most suitable protocols and allocate resources efficiently, ultimately saving lives and reducing suffering. Legal and ethical considerations. Responding to emergencies involves significant legal and ethical responsibilities that must be understood by all responders. Key legal principles include the duty of care, which obligates individuals to act reasonably to prevent harm to others, and consent, which requires permission before providing medical assistance. Good Samaritan laws exist in many jurisdictions to protect individuals who voluntarily offer reasonable aid to those in need, without expectation of reward. However, these laws do not absolve responders from acting within their training and competence. Understanding these legal frameworks helps protect both the responder and the person receiving aid, ensuring actions are both helpful and lawful. Ethical considerations often involve balancing the immediate need for intervention with respect for an individual's autonomy and privacy. Responders must strive to act in the best interest of the casualty, maintaining confidentiality and avoiding discrimination. The principle of do no harm is paramount, guiding decisions to ensure that interventions do not inadvertently worsen a situation. In complex scenarios, ethical dilemmas may arise, requiring careful judgment and adherence to established protocols. Continuous training on legal and ethical guidelines is essential for all emergency responders to ensure professional and responsible conduct during critical incidents. Personal safety and scene assessment. Prioritizing personal safety is the most critical step in any emergency response. A responder who becomes a casualty cannot help others, so self-protection is paramount. This involves assessing the scene for potential hazards before approaching, such as traffic, fire, hazardous materials, or unstable structures. Always ensure it is safe to approach an incident. If the scene is unsafe, the first action is to call for professional help and wait for their arrival, maintaining a safe distance. Never put yourself in unnecessary danger, as this can escalate the emergency and endanger more lives. A systematic approach to scene assessment ensures that risks are identified and managed effectively. Once personal safety is assured, a rapid scene assessment helps to understand the nature of the emergency and the number of casualties. This involves looking for clues about what happened, identifying potential dangers, and determining the resources needed. Key steps include checking for immediate threats to life, identifying the mechanism of injury or illness, estimating the number of people involved, noting any bystanders who might assist or provide information. This initial assessment guides subsequent actions, such as calling for appropriate emergency services and initiating first aid. A thorough but swift assessment is crucial for effective and safe emergency management. Calling for professional help. Activating emergency services is a critical step in any emergency response, ensuring that professional help arrives swiftly. Knowing when and how to call for help can significantly impact the outcome of an incident. In most regions, a universal emergency number, such as 911, 999, or 112, connects callers to police, fire, and ambulance services. It is essential to call this number as soon as possible if a situation is beyond your capabilities or requires specialized intervention. Do not hesitate to call, even if you are unsure, as early notification can save lives. This immediate action ensures that a coordinated professional response is initiated without delay. When making an emergency call, remain calm and provide clear, concise information to the operator. Be prepared to state your exact location, including street address, city, and any landmarks, the type of emergency, e.g., fire, medical, accident, the number of people involved and their condition, any known hazards or dangers at the scene. Follow the operator's instructions carefully and do not hang up until told to do so. They may provide critical pre-arrival instructions or ask further questions to dispatch the most appropriate resources. Your ability to communicate effectively during this call is vital for a successful professional intervention. Basic life support, CPR overview. Cardiopulmonary resuscitation, CPR, is a life-saving technique used in emergencies when someone's breathing or heart stops. It involves a combination of chest compressions and rescue breaths to maintain blood flow to the brain and other vital organs until professional medical help arrives. The immediate application of CPR can significantly increase a person's chances of survival, especially if initiated within the first few minutes of cardiac arrest. It is a fundamental skill for any emergency responder, empowering them to act decisively in critical moments. Early and effective CPR is a bridge to advanced medical care. The standard adult CPR sequence for a single rescuer typically follows the CAB approach. Compressions. Perform 30 chest compressions at a rate of 100 to 120 per minute to a depth of at least 2 inches, 5 centimeters. Airway. Open the airway using the head tilt, chin lift maneuver. Breathing. Deliver 2 rescue breaths, each lasting about 1 second, making sure the chest rises. Continue cycles of 30 compressions and 2 breaths until the person shows signs of life, an AED becomes available, or professional help takes over. Consistent, high-quality compressions are the most crucial component of effective CPR. Basic life support, choking. Choking occurs when an object, usually food, becomes lodged in the airway, blocking airflow to the lungs. It is a life-threatening emergency that requires immediate intervention to clear the obstruction. Recognizing the signs of choking is crucial. A person may be unable to speak, cough, or breathe, and might clutch their throat. A partial obstruction allows some air movement, characterized by a weak cough or noisy breathing, while a complete obstruction is silent and more urgent. Swift and effective action can dislodge the object and restore breathing, preventing serious complications or even death. Understanding the difference between partial and complete obstruction guides the appropriate response. For an adult who is conscious and choking, the recommended first aid involves a combination of back blows and abdominal thrusts, Heimlich maneuver. Deliver 5 sharp back blows between the shoulder blades with the heel of your hand. If back blows are unsuccessful, perform 5 abdominal thrusts. Stand behind the person. Wrap your arms around their waist. Make a fist. Place it just above the navel, and thrust sharply inwards and upwards. Alternate between 5 back blows and 5 abdominal thrusts until the object is dislodged or the person becomes unconscious. If the person becomes unconscious, begin CPR. This sequence is designed to create pressure that can expel the foreign object from the airway. Managing bleeding and wounds. Effective management of bleeding and wounds is a critical first aid skill, as uncontrolled blood loss can quickly become life-threatening. Wounds can range from minor cuts and scrapes to severe lacerations and punctures. The primary goal is to stop the bleeding, prevent infection, and protect the wound from further injury. Understanding the different types of bleeding, arterial, venous, and capillary, helps in assessing the severity and applying appropriate control measures. Prompt and correct intervention can stabilize the casualty and prevent complications, making it a foundational aspect of emergency response. Always prioritize stopping severe bleeding immediately. To control external bleeding, apply direct pressure to the wound using a clean cloth or sterile dressing. Elevate the injured part above the heart if possible, and apply a pressure bandage to maintain continuous pressure. If bleeding is severe and direct pressure is insufficient, consider applying a tourniquet as a last resort for limb injuries, ensuring it is placed high and tight above the wound. For minor wounds, clean the area with mild soap and water. Apply an antiseptic and cover with a sterile dressing. Always wear gloves to protect yourself from blood-borne pathogens. Proper wound care minimizes infection risk and promotes healing. Shock management. Shock is a life-threatening condition that occurs when the body is not getting enough blood flow, leading to insufficient oxygen delivery to organs and tissues. It can result from severe injury, illness, or trauma, and if left untreated, can lead to organ damage or death. Recognizing the signs of shock early is crucial for effective intervention. Common causes include significant blood loss, severe allergic reactions, heart attack, or overwhelming infection. Understanding the underlying mechanisms helps responders to anticipate and address the specific type of shock, improving the casualty's prognosis. Prompt recognition and initial management are vital for survival. Signs and symptoms of shock often include pale, cool, clammy skin, rapid, weak pulse, rapid, shallow breathing, nausea or vomiting, altered mental state, such as confusion or anxiety, dilated pupils. To manage shock, lay the person down. Elevate their legs if no spinal injury is suspected, and keep them warm with a blanket. Loosen any tight clothing and reassure them. Do not give them anything to eat or drink. Continuously monitor their vital signs and be prepared to perform CPR if necessary. Seek immediate professional medical help, as shock requires urgent medical attention to address the underlying cause and stabilize the patient. Burns and scalds. Burns and scalds are injuries to the skin or other organic tissue primarily caused by heat, but also by radiation, radioactivity, electricity, friction, or chemicals. Scalds are a type of burn caused by hot liquids or steam. The severity of a burn depends on its depth, size, and location, as well as the age and general health of the casualty. Proper first aid for burns is crucial to minimize tissue damage, prevent infection, and alleviate pain. Understanding the different classifications of burns helps in determining the appropriate immediate care and when to seek professional medical attention. Early intervention can significantly impact recovery. Burns are typically classified into 3 degrees. First-degree burns affect only the outer layer of skin, causing redness and pain. Second-degree burns affect the outer and underlying layers, causing redness, pain, blisters, and swelling. Third-degree burns extend into all layers of skin and potentially underlying tissue, appearing white, leathery, or charred, often with little to no pain due to nerve damage. For first and second-degree burns, cool the burn with cool or lukewarm running water for at least 10 to 20 minutes. Remove any clothing or jewelry near the burn, unless it's stuck to the skin. Cover the burn with a sterile, non-adhesive dressing. For third-degree burns, call emergency services immediately. Do not apply water, and cover loosely with a sterile dressing. Never break blisters or apply ice, butter, or ointments to severe burns. Fractures and dislocations. Fractures are breaks in a bone, while dislocations occur when bones are forced out of alignment at a joint. Both are painful and require immediate first aid to prevent further injury and reduce discomfort. Recognizing the signs and symptoms is crucial for proper management. A fracture can be open, skin broken, or closed, skin intact, and its severity varies. Dislocations often present with visible deformity and extreme pain. Understanding these distinctions helps in providing appropriate initial care and preparing the casualty for professional medical attention. Swift and gentle handling is paramount to avoid exacerbating the injury. Signs of a fracture or dislocation may include severe pain, swelling and bruising, deformity or unnatural angle of the limb, inability to move the injured part, grating sensation or sound, crepitus. For suspected fractures or dislocations, the primary goal is to immobilize the injured area to prevent movement. Use a splint made from rigid materials like rolled newspapers or sticks, and bandages to secure the limb in the position found. Apply ice packs to reduce swelling and pain, and elevate the injured limb if possible. Always call for professional medical help, as these injuries require X-rays and specialized treatment. Do not attempt to realign a bone or joint yourself, as this can cause further damage. Head, neck, and spinal injuries. Head, neck, and spinal injuries are among the most serious emergencies, as they can lead to permanent disability or death. These injuries often result from falls, sports accidents, vehicle collisions, or direct blows. The primary concern is protecting the spinal cord from further damage, as any movement of the head or neck can worsen the injury. Always suspect a spinal injury in cases of significant trauma, unconsciousness, or complaints of neck, back pain, numbness, or weakness. Extreme caution and minimal movement are paramount when dealing with such casualties. Recognizing the potential for these injuries is the first step in safe management. Signs and symptoms of head, neck, or spinal injury may include severe pain or pressure in the head, neck, or back, numbness, tingling, or weakness in the limbs, loss of movement or paralysis, loss of consciousness or altered mental state, impaired breathing or vision, bruising or swelling on the head or spine. If a spinal injury is suspected, do not move the casualty unless absolutely necessary for their immediate safety. For example, from a burning building. Stabilize the head and neck in the position found, using your hands or improvised support. Reassure the person and keep them warm. Call emergency services immediately and await their arrival. providing continuous monitoring. Emphasize minimal movement and maintaining alignment to prevent further damage. Medical emergencies. Seizures. Seizures are sudden, uncontrolled disturbances in the brain caused by abnormal electrical activity. They can manifest in various ways, from brief, staring spells to violent shaking and loss of consciousness. While some seizures are a symptom of epilepsy, others can be triggered by fever, head injury, stroke, or low blood sugar. Recognizing the different types of seizures and knowing how to provide appropriate first aid is crucial for ensuring the casualty's safety and comfort. The primary goal is to protect the person from injury during the seizure and manage their recovery afterward. Understanding the triggers and types of seizures can inform a more effective response. During a seizure, the most important actions are to protect the person from injury and ensure their airway remains clear. Ease the person to the floor and clear the area around them of any hard or sharp objects. Place something soft and flat, like a folded jacket, under their head. Turn them gently onto one side to help with breathing and prevent choking on vomit or saliva. Loosen any tight clothing around their neck. Time the seizure. Do not restrain the person or put anything in their mouth. After the seizure, the person may be confused or sleepy. Stay with them, reassure them, and monitor their breathing until they recover. Call emergency services if the seizure lasts longer than 5 minutes, if it's their first seizure, or if they have difficulty breathing after it stops. Medical emergencies. Diabetic crisis. Diabetic crises, primarily hypoglycemia, low blood sugar, and hyperglycemia, high blood sugar, are common medical emergencies that can rapidly become life-threatening if not managed promptly. Hypoglycemia is often more acute and dangerous in the short term, characterized by sudden confusion, sweating, tremors, and weakness. Hyperglycemia develops more slowly, with symptoms like increased thirst, frequent urination, and fatigue. Recognizing the signs of each condition is vital for providing appropriate first aid. Understanding the differences helps responders to administer the correct interventions, which can be as simple as providing sugar or calling for medical help. Early recognition is key to preventing severe complications. For a conscious person experiencing hypoglycemia, immediately give them something sugary to eat or drink, such as fruit juice, glucose tablets, or candy. Monitor their condition closely and seek medical attention if symptoms do not improve within 10 to 15 minutes. For hyperglycemia, which is less urgent in the immediate term, encourage the person to drink water and seek medical advice. If the person becomes unconscious in either scenario, do not attempt to give them anything by mouth. Instead, place them in the recovery position and call emergency services immediately. Always inform paramedics about the suspected diabetic crisis and any actions taken, as this information is crucial for their treatment plan. Allergic reactions and anaphylaxis. Allergic reactions occur when the immune system overreacts to a harmless substance, known as an allergen. These reactions can range from mild symptoms like skin rashes and itching to severe, life-threatening anaphylaxis. Anaphylaxis is a severe, systemic allergic reaction that can cause rapid swelling, breathing difficulties, and a sudden drop in blood pressure. Common triggers include certain foods, insect stings, medications, and latex. Recognizing the signs of a severe allergic reaction and acting quickly is paramount, as anaphylaxis can progress rapidly and lead to death if not treated immediately. Early identification and intervention are critical for survival. Signs of anaphylaxis include difficulty breathing, wheezing or persistent cough, swelling of the face, lips, tongue, or throat, hives, rash, or widespread redness, rapid, weak pulse and dizziness, nausea, vomiting, or abdominal pain, feeling of impending doom. If anaphylaxis is suspected, immediately call emergency services. If the person has an epinephrine autoinjector, EpiPen, assist them in administering it or administer it yourself if trained. Help the person lie flat with their legs elevated, unless they are having breathing difficulties, in which case, help them sit upright. Reassure them and monitor their breathing and pulse until professional help arrives. Even if symptoms improve after epinephrine, medical follow-up is essential. Environmental emergencies, heat-related. Heat-related emergencies occur when the body's temperature regulation system is overwhelmed by excessive heat, leading to conditions like heat exhaustion and heat stroke. These conditions are particularly dangerous in hot and humid environments, especially for vulnerable populations such as the elderly, young children, and individuals with chronic illnesses. Heat exhaustion is characterized by heavy sweating, weakness, dizziness, and nausea, while heat stroke is a life-threatening condition where the body's core temperature rises dangerously high, leading to confusion, seizures, and loss of consciousness. Recognizing the progression from mild heat stress to severe heat stroke is vital for timely intervention. Prevention is always better than cure in these situations. For heat exhaustion, move the person to a cooler environment, loosen clothing, and apply cool, wet cloths to their skin. Encourage them to sip cool water. Monitor them closely, and if symptoms worsen or do not improve within an hour, seek medical attention. For suspected heat stroke, which is a medical emergency, immediately call emergency services. While waiting for help, move the person to the coolest possible area. Remove excess clothing, and rapidly cool their body using any available means, such as cool water baths, wet sheets, or ice packs applied to the neck, armpits, and groin. Do not give them anything to drink as they are unconscious or confused. Rapid cooling is the most critical intervention for heat stroke. Environmental emergencies. Cold-related emergencies, such as hypothermia and frostbite, occur when the body loses heat faster than it can produce it, leading to dangerously low core body temperature or localized tissue freezing. These conditions are prevalent in cold environments and can affect anyone exposed to low temperatures, especially those inadequately dressed or prolonged exposure. Hypothermia is a systemic condition where the body's core temperature drops below 95 degrees Fahrenheit, 35 Celsius, impairing brain function and heart activity. Frostbite is localized tissue damage caused by freezing, typically affecting extremities like fingers, toes, ears, and nose. Recognizing the early signs of these conditions is crucial for preventing severe damage and ensuring survival. For hypothermia, move the person to a warm, dry place. Remove any wet clothing and replace it with dry, warm layers. Wrap them in blankets or sleeping bags and share body heat if necessary. Offer warm, sweet drinks if they are conscious and able to swallow. Do not rub their skin or give them alcohol. For frostbite, gently warm the affected area using body heat or warm, not hot water. Do not rub or massage the frostbitten area. And do not use direct heat sources like fires or heating pads. Cover the area with sterile dressings and separate frostbitten fingers or toes with gauze. Seek immediate medical attention for both conditions, as they can lead to serious complications, including tissue loss or cardiac arrest. Gradual rewarming is key. Psychological first aid. Psychological first aid, PFA, is a humane, supportive, and practical response to people who are suffering and may need support after experiencing highly stressful events. It is not professional counseling or therapy, but rather a set of practical skills to help individuals cope in the immediate aftermath of a crisis. PFA aims to reduce initial distress, foster adaptive functioning, and provide comfort and practical support. It is applicable in various emergency settings, from natural disasters to accidents and acts of violence, Providing PFA can significantly mitigate the long-term psychological impact of traumatic events, promoting resilience and recovery. The core actions of PFA involve: look, assess the situation and identify people who may need help. Listen, approach people, introduce yourself, and listen to their needs and concerns without pressuring them to talk. Link, help people connect with practical support, such as food, water, shelter, information, and social support networks. This approach emphasizes a non-intrusive, compassionate presence, respecting privacy and cultural differences. It focuses on helping people feel safe, calm, and connected, while empowering them to take steps to meet their own needs. PFA is about being present, offering practical assistance, and facilitating access to further support, rather than providing formal therapy. It is a vital component of holistic emergency response. Emergency preparedness planning. Emergency preparedness planning is the process of anticipating potential emergencies and developing strategies to mitigate their impact. It involves creating detailed plans, assembling necessary resources, and conducting training exercises to ensure readiness. This proactive approach is crucial for individuals, families, communities, and organizations to effectively respond to and recover from various crises. A well-developed plan can significantly reduce casualties, minimize property damage, and accelerate recovery efforts. It shifts the focus from reactive responses to proactive measures, fostering a culture of safety and resilience. Effective planning considers a wide range of potential hazards. Key components of emergency preparedness planning include developing an emergency kit with essential supplies, food, water, first aid, medications, creating a family communication plan, including out-of-state contacts, identifying safe meeting places both inside and outside the home, practicing evacuation routes and shelter-in-place procedures, understanding local emergency alerts and warning systems. Regular review and updating of these plans are essential to ensure their continued relevance and effectiveness. Engaging in community-level preparedness initiatives further strengthens overall resilience. By taking these steps, individuals and groups can enhance their ability to cope with unexpected events and protect themselves and their loved ones. Review and continuous improvement. Emergency response is an evolving field, and continuous review and improvement are essential for maintaining effectiveness and adapting to new challenges. After any emergency incident or training exercise, a debriefing process allows responders to reflect on their actions, identify strengths, and pinpoint areas for improvement. This critical step fosters a learning culture, ensuring that lessons learned are incorporated into future planning and training. Without systematic review, valuable insights can be lost, and the same mistakes might be repeated. Commitment to continuous improvement enhances individual competence and strengthens overall organizational readiness. It is a cyclical process of learning and refinement. Key aspects of continuous improvement include post-incident debriefings and critiques, updating emergency plans and protocols based on lessons learned, regular refresher training and drills, staying informed about new best practices and technologies, seeking feedback from all levels of responders and affected individuals. By embracing a mindset of ongoing learning and adaptation, emergency responders can enhance their skills, improve coordination, and ultimately provide more effective and compassionate care during future crises. This commitment to excellence ensures that response capabilities remain robust and responsive to the dynamic nature of emergencies.